COVID-19 update.
Okay, so a couple things on the agenda. The first is related to the COVID, what we call a post-COVID transition team. As everybody probably knows, the governor established the reopening advisory committee led by the lieutenant governor and 17 other members that they got stood up at the end of April. In just a few short days, they've, I think, met almost 20 times, taking input and different types of information from the public, from industry leaders, from healthcare professionals, to work on establishing the phased reopening of the economy in Massachusetts and getting businesses opened again, provide guidelines for all of us on what things are going to be in place, certainly over the course of at least months, not days, but at least months to come. And in that regard, as you start at the state level, the county has also stood up a regional task force to look at reopening and other things for the Cape and Islands. I was asked to be part of that task force as the Upper Cape Town Administrator. There's a town administrator for the Mid Cape and one from the Lower Cape as well, led by Sean O'Brien and Wendy Norcross from the Chamber, and a number of other folks, particularly the Cape and Islands legislative delegation. Senator Sear and all the representatives are part of this. We had our first meeting today. And frankly, then you take that down to the town level, and of course, we're already having internal discussions about what reconstitution of town operations may look like, and then how do you integrate that in with the business community in Bourne and across Cape Cod. So I've had some discussions with Maria Oliva, but what you end up having in all of this is sort of who goes first. And in all of our discussions that we've had about this, really May 18th is a key date for us to be able to see what it is that the state level is going to pass down to all of us as sort of the guidelines, the rules, procedures. It's a phased reopening. The governor and the lieutenant governor have been continuing to hammer on this. The last few press conferences to make sure people are aware that May 18th is not the reopening date. It's simply the date that the report from this advisory committee is due to the governor, and its public release. And then over the course of time, things will be phased in. So we're kind of in a situation where it's we're all sort of trying to get ourselves ready to get back to whatever this new normal is going to be. So our post-COVID transition team is really the initial start of that. I imagine that will continue to grow as we get a little bit further down stream on this thing and start to include folks from the community and the business community on what support they need and what it is that we can do to help them as well get back up onto their feet and make sure that they're successful in trying to get restarted. So there's a lot going on. We spend most of the day between Zoom meetings, teleconferences, watching press conferences, trying to make sure that we're plugged into all of this. Terry Garino is also on a subcommittee of the task force that I'm on, which is a good thing because Bourne now has a seat at a table that is going to be important for the regional economy. Part of what we talked about today in our first meeting, a lot of it had to do with trying to develop consistency as much as we can, knowing that some communities have unique things they deal with, is to have consistency in what we do, so that if you're wanting to go from Bourne to Sandwich or Harwich to Chatham, that you don't have to spend an hour on the internet to find out what the rules are in the town next to you. So the hope is, as these things come down, that there can be built-in consistency within the different communities on the Cape to try to make it as seamless as we can, understanding that there may be certain unique characteristics about a particular town that may be a little bit different. So we'll have to see how that plays out over time. So more to follow on that. Right now we're working just internally to figure out how we're going to get ourselves back started again, but that will continue to grow in the coming weeks as we get more information from the state. So I'll pause there for a minute to see if any of the board members have any questions or comments, things they want to make sure are considered.
Peter? Thank you. One thing we got to look into for the summer months and for the fall is uh, the MS-a-thon that comes through our roads and down the Mass Maritime.
What is it?
Um,
The what?
multiple Sclerosis Society. There, Nancy was going to reach out. I guess Glenn told me last week. I don't know if she ever heard back. We know that Pam Mass Challenge. We have heard from them, or I have, that they're not going to be using Mass Maritime this year as they normally do because they're going to be doing something virtually and drastically different, but with the same outcome to raise money for cancer. We have to decide on the parade at some point because July 4th is going to be before you know it. Canal Day in September, Best Buddies. I mean, the list can go on, and I think at some point with this post COVID-19, we need to have a discussion over what's the position of the board or what we want, what we would like to see done on town property or the town roads. At some point we're going to have to decide one way or another.
Right. So we put a spreadsheet together already. We broke it down into things that already have permits approved by the town, those that we have applications for but have not brought to the board, and then there are the ones, some of which you just mentioned, that we know happen on a pretty regular basis in town during the summer months. So that is absolutely something that's going to need to be addressed here pretty quickly. If you saw in the news, the town of Falmouth approach was they essentially canceled all events through 31 August, regardless, from what I read anyways, regardless of size. And then if somebody wanted to petition the board to have whatever event they were planning on, they'd have to. So it was kind of like everybody's canceled, and if you want to appeal, if you will, then you can do that to the Board of Selectmen. So we do need to figure out how we want to handle that. Like, we get a lot of calls about people that are thinking about events, wanting us to tell them whether they should or shouldn't continue to plan. I try to avoid giving them answers because, frankly, right now, a lot of it's going to depend on what the guidance says in terms of gatherings and other, public health things that will be, sort of coming down the pike. Frankly, if folks have to make irrevocable decisions about an event, whether it's signing contracts or spending seed money or whatever, then obviously they need to think about those things pretty quickly. So yeah, Peter, you're absolutely right. I can share that spreadsheet of things that we know. We know we have Canal Day. We know we have summer concerts in Buzzards Bay Park. We need to probably start thinking about how the board wants to handle each of those particular situations.
It's just a follow-up. I understand, some of the communities have outright canceled already, but I think we should think long and hard, before we permanently recommend we not do some of these things. I mean, because a lot of these things are the fabric of the community, and if it's anything we can do to safely host these events, it will boost the morale and the morale in town back up. But I understand that safety is first and foremost, and I support that. But let's try to think long and hard and long thought out before we start making these decisions. Because once we make them, they're binding. And so, and like I said, I'll support what the board does and what the staff and what the governor recommends. But I guess it's hard right now with everybody. We're all in the same boat. And I'm just hoping there'll be some sort of reasonable light or a new normal at the end of the tunnel at some point.
Yeah, I'm looking at my spreadsheet right now. The MS bike ride has been canceled. So, Peter, I think that's the one you were referencing. Yeah, I mean, our viewpoint, at least the way I've been handling things, is you handle them as they come and not necessarily presuming what may or may not be happening in August or September yet. And again, we're waiting. I mean, May 18th is going to be a key date, I think, for what are the recommendations going to be. Particularly, the one that's really the most constraining is how many people can you have in one space. Is probably the biggest thing. And the Lieutenant Governor addressed it today during a municipal CEO conference call we have every Tuesday. And they don't know the answer to that yet. They're discussing it within the reopening advisory committee, but right now it's 10 or less. So, that's going to be a key piece of information about, particularly if it's an executive order, because, those aren't advisory. So yeah, I mean, right now we have some time. I don't have anything on my spreadsheet in June. The first thing I'm showing is the July 4th parade is, at least on this particular spreadsheet, for things that are still out there.
Jim?
Yes, thank you, Madam Chair. I am kind of piggybacking with Peter on this. I think we should, kind of take a very measured approach. I think there were some communities that just carte blanche canceled everything for the summer. And really not every event is equal. Some events are spaced out, some events are not. And, I think that everything has to be taken on its merits in addition to whatever guidance is given by the state. And we don't really know what that guidance is yet. And as Tony said, May 18th might be the time that we know some more, and there'll probably be further guidance beyond that. But I don't think that, and that's where I get a little nervous about what the unified approach is for the Cape with regard, I think there's some things that we can provide a unified approach, and then I think there could be some things that, every town might have a disagreement about what the approach is. Some towns are closing beaches, and some towns are closing golf courses, and I know the state closed that, but there could be further local kind of semantics as we all move forward, and we don't know what each town might do. So I don't know exactly what the unified approach is from that standpoint, but I think we have to do what's best for our community.
Right. Sounds like that. Bourne being a little bit independent, but also wanting to make sure that there is the unified front. But there may be some areas that we end up deciding, slightly differently or an altered approach. Is the Army Corps involved at all in any of this? Because I know that they act independently at all, but it's obviously a significant part of our town with the canal and the support or not support of them closing off parking lots and things like that. That falls to the town in terms of parking regulations and things like that.
Well, in some cases, I mean, I actually talked to the police chief about this today. I mean, the big canal parking lots on the scenic highway belong to the Corps, so those are federal, and they're following federal guidelines. So I have a due out to call them just to, the canal is obviously 5 miles long. It's a big, there's little parking lots, there's big parking lots. They're following their federal guidelines. Obviously, they closed the parking lot at Scussett Beach. Well, actually, that's state. I take that back. So I don't know. They haven't really done anything, although they did put spacing cones at the lot down closer to where their building is. Now, whether people are moving those or not, I don't know. I haven't been back down there, but I did see them out there. Which isn't surprising. They're very movable.
I mean, one of my observations, and I don't really have an opinion one way or another on it. It's just an observation, is that the parking with or without the cones is still up through the neighborhoods. People are just chomping at the bit to get outdoors and to have that accessibility. So the parking lot that actually is closest to where I live is full to overflowing with the cones removed, any time that it's sunny out. So
right.
As I said, I don't really have an opinion about it. I just have an observation.
Yeah. Well, it's one of those hard ones to control, because we've gotten a complaint here and there about overcrowding, but with something that's 5 mile long, it's almost impossible to control how many people are actually physically on the path at any given time. Obviously, starting tomorrow, we have the mask our face covering executive order takes effect, which includes outdoor spaces. So, I mean, if you're not able to social distance from one another, even in the outdoors, you're supposed to wear, a face covering. So, yeah, I mean, it's a difficult one.
Yeah, it is. Other questions, comments? Okay, carry on.
Okay. The other COVID update is because I know people have been asking about this. When we report the positives, or well, I shouldn't say we, but when the Department of Public Health reports the positives weekly on Wednesdays for each town, if you remember, those are the number of total positives that have occurred since we started counting. It doesn't really give you an idea about what the recovery is. In other words, how many sort of active cases are there, because they've been spending most of their time on tracking the positives and then the contact tracing that's the governor talks about, which is extremely important. Doesn't leave a lot of time to try to go back and sort of capture where are we truly in active cases. So Terry Garino, the health agent, commented this afternoon on my way home, and we contract with the VNA of Cape Cod to do our public health nursing for us. And one of them actually went down the rabbit hole to try to figure this out. And so right now we have 5 positive cases in the town of Bourne, not including the areas in the long-term care facilities, which are pretty contained, in nursing homes and things. We have 5 positive cases in Bourne. So, current cases, I should say. Everybody else has, recovered. Obviously, we had a couple of people pass away, but so that's a good thing. The governor talked today that numbers are starting to turn. I mean, they're not turning quickly, but they're seeing the hospitalization rate go down. The number of folks in ICU have gone down. The ratio or the percentage of positives to the total number tested is now down below 20%. It was mentioned on one of the calls today, they want to see that get down below 10%. So we're headed in that direction. Not too long ago, it was well over 30. But a lot of what you're seeing today with the positive test results is they're focusing on particular communities, the long-term care facilities, the homeless population, and those type of things, testing there, which tends to probably keep the numbers up a little bit just because they tend to be more prominent. So anyway, so they're doing, the numbers are starting to turn, but we're not there yet. So that's sort of the update on that. There is a Board of Health meeting tomorrow night. I know they're going to be talking. I think they're going to be talking about events and where they stand on some of that type of stuff. So I haven't seen their agenda yet, but they are meeting tomorrow night to start talking about some of those types of things. So and then lastly, the Cape and Islands delegation sent out a guidance memo last week that was signed by the entire Cape delegation, the leadership of Cape Cod Healthcare and Nantucket Cottage Hospital, related to providing some guidance to the Cape seasonal residents and visitors, over the course of the summer. Again, an attempt to know that, a lot of people are going to be coming to the Cape that normally come, and, what are some of the considerations that at least we're asking them to take into account if they do, come to visit the Cape. So one of the asks of that was, if communities felt comfortable with the guidance, to essentially sign on to it, and, your little logo goes at the bottom of the letter, as sort of support for, what they're trying to do as it relates to the seasonal visitors and residents that come here. So I did pass it by Terry Garino, and she said it pretty much, summarized the advisories we're already working on, and obviously it's an attempt to, sort of have a unified message in formatting and trying to put this out. So she had a positive recommendation as well for, Bourne, sort of putting in support behind this.
Does anyone have any questions about that document, that memo?
It's pretty general. It's not. Yeah.
So I'd like to see if we could entertain a motion to concur with the Cape Islands delegation COVID-19 guidance memo for seasonal residents and visitors.
So move.
Seconded.
Discussion? Okay, roll call vote. Peter?
Yes.
George?
Yes.
Jim?
Yes.
Jared?
Yes.
Judith? Yes, 500.